Labral repairs are one of the most common surgeries that I do. The labrum is a structure which is attached to the rim of the socket. Tears of the labrum always involve detachment of the labrum from the rim of the socket. And repairs are also always done the same way. They involve putting stitches around the torn labrum and reattaching it back onto the rim using small anchors embedded within the bone. Even though I do the surgery the same way every time, small differences between patients can mean that some surgeries are a breeze that take only about 30 minutes, whilst others can be quite the exercise in improvisation and drawing from previous surgical experience. In this first case, the tear looked trivial initially but was found to be a lot more extensive during the surgery. But all the same, we get a nice repair here. In this second case, the tear looks nasty and craggy. But that's a nice looking result over there. And in this last case, the labrum could not even be seen because it had fallen away and scarred down. But with some release of the fibrous tissue, we managed to bring the labrum up and obtain a good repair. All the same, results are often excellent and patients return fully to their sports. I'm Dr. Bryan Tan, and I'll see you in my next video.